Welcome to this week's Health Wrap. Hey, Carla.
Hey, Carolyn. Hey, everybody that's joining us. We're a little relaxed today. I've got on my little golf shirt. Carolyn has on her little running suit because you know what? Everybody's tired. And we want to have a theme today of relaxation and taking care of yourself.
Absolutely. I don't even, I stopped counting the weeks. We continue to have quarantine despite states opening up. I know this week New York opened up. And then the other story that a lot of people were paying attention to, which, it reminded me back to the very beginning when we started sending out information and doing this information outreach. And one of our doctors said, you know what, there are two pandemics. One is the actual pandemic, and the other one is the pandemic of misinformation. Well, that's what
Yes,
this reminded me of, right? So there's now this whole big debate about whether asymptomatic versus pre-symptomatic and what the difference between the two. If you're asymptomatic, I think if you remember Dr. Hildreth said you don't really show
yes.
some symptoms. Here's the bottom line. This is what you need to know about this story. Okay. Um, in both instances, you are in a position where you can actually spread the disease or spread the virus and infect someone else. So I think that the safest way, I mean, one in the case of asymptomatic, you're not showing any symptoms, but the bottom line is in both instances, you can actually spread the virus, which is why, we got to keep reminding folks, this is not over yet, people. I don't care what you hear, what you read, what other folks are telling you. This is not over. In fact, in my state where I'm sitting, South Carolina, we saw a surge along with about, I think, 7 or 12 other states. We're talking about 50% shoot up. So this is serious. Our state epidemiologist, Carla, said she was more concerned than she has been at any point in this virus and the COVID-19 scare. So again, it is not over.
Oh, absolutely. And people, I've been out like when you go to the grocery store and people without mask and everything. So it is not over. We still need to wear a mask and social distance. Now, what I saw in my adopted state, Georgia, voter machine coronavirus forced long lines on Georgia voters. Well, the Atlanta Journal and Constitution reported that there were a lot of people that were very upset because of these extremely long lines. And they're used to long lines, but these were even longer because there was a problem with the voting machines in certain areas. Now, one of the things when they said, oh, coronavirus, well, what happens is you have to remember that a lot of the people that work at the polls are seasoned people and mature people who've been doing it for decades and they really enjoy it and they're really good at it. So a lot of those people, the elderly people, were like, I'm not going out there to do that this year right now because of COVID-19. So that's part of the slowdown with that. And so a lot of people were trying to figure out how to do the machines, but they were saying that they think something else was going on, and they're examining to see, well, why are the machines only in certain areas? But again, a lot of those people who were seasoned people were not working the polls.
Well, we don't talk politics, so we do health on this show, but I will tell you this. Voter suppression is real. And in the case of Tuesday's primary, we had people here, I think, that were voting at 9:30 at night. So my best advice to people for your health, for your nerves, so you're not stressed out, as we look towards November, you should plan to vote early. If you can do an absentee ballot, do an absentee ballot and plan to vote early. Far less stressful, far less stressful. We still talk about the pandemic of misinformation. I think this guy here could probably be a poster child for that. Okay. You might not have seen this story this week, but this is a lawmaker in Ohio. And he asked a question during a hearing as to whether or not we are seeing more cases in the communities of color. The colored is the word he used.
Colored population.
Yes, the colored population. He asked the question as to whether or not we're seeing more cases because they don't wash their hands as adequately as others. Again, put this under the list of the pandemic of misinformation. Okay. That is not why we're seeing the cases. We've been telling you this for 8 weeks. Our doctors, the people who go to med school, who have med degrees, have been on the show, and they've been saying that what we're seeing is a result of health disparities in populations that are underserved and do not have adequate health insurance, adequate access to the doctor, adequate resources in terms of food, people who live in food deserts, people who have economic challenges. And then we, of course, get on top of it the whole economic shutdown that we've seen as a result of the pandemic. And so all of those things contribute to what we call health disparities. And that's what we've been talking about from the very beginning, because we were warned that if the pandemic came in, those who were already suffering from pre-existing conditions or falling under that heading of health disparities would be in trouble.
And that's one of the things that we do want to do on our show, is to reduce health disparities and underlying conditions. And one of the things that we've talked about is mental health, and that's part of self-care. So in essence, online, they have the long-term mental health effects for Black people living through coronavirus and racial trauma. And, we've talked about on the show about mental health. We've had psychologists, psychiatrists on the show talking about that in the African American community. One of the things in the article I just wanted to point out, it was talking about how exhausting it is, especially during the pandemic. And we need to take care of ourselves. And one of those things is yoga, gardening, and a healthy diet. And that's some of the things that we're going to look at today in the show.
Absolutely. So, in fact, we've got special guests with us today, so you're not going to want to go anywhere. And those special guests will actually be taking us through some creative ways to do yoga. And they'll also be sharing with us some wonderful recipes. And we're going to get to all of that right after these messages.
I'm Dr. Thaddeus John Bell. I want to talk to you today about the COVID-19 crisis. It's very important that you practice social distancing, that you wash your hands for 20 seconds, and that you use the mask when you're out in public. I'm Thaddeus John Bell, closing the gap in health disparities for African Americans and the underserved.
South Carolinians are asking, what can they do to stop the spread of COVID-19? Our response? Answer the call. Through what's called contact tracing, DHEC's trained contact tracers call everyone who has tested positive for COVID-19 and those who could have been exposed. All information is confidential, voluntary, and collected over the phone. This information helps us protect you, your loved ones, and your community. Answer the call to keep your community safe. Visit scdhec.gov/COVID-19.
All right, Carolyn. So, I've been telling you about Kirby Miller. And
Yeah.
Kirby Miller, oh my gosh, I can't even describe her. She's a scientist. She works in making sure that Vanderbilt Hospital stays on point with informatics, but her passion is food and cooking. And Kirby has her own brand that is going around, this is my passion and everything that I like to do. So she's going to be doing cookbooks. She does recipes, and we look to see some big things coming for her. But we asked her, what can we do? We want to make something really good and delicious to eat, but kind of change it up a little to make it take some of the calories out. And this is what Kirby did for us.
Hi, Health Wrap family. My name is Kirby Miller, and I'm the owner of Kanimi Kitchen, which is a culinary experience company. And the fundamental purpose of my business is to cultivate meaningful connections through food. And today I'm going to show you a quick and easy recipe that's flavorful, delicious, and we have some healthier swaps, so you don't have to compromise flavor for a healthier option. So we're gonna jump right in. We're gonna make a light Alfredo sauce, and I have some noodles, but we're also going to make some zoodles, which is really just noodles made out of zucchini, and I'll show you how to do that. So if you're not fully committed to switching over to a vegetable-based noodle, then you can do half and half or play around with that ratio until you're comfortable. Here we have a spiralizer, and those are super easily accessible in a local store, or if you shop online, you can find one at Amazon. So I've just cut the zucchini in half, and you just kind of twist it through your spiralizer. This is a super fun and easy recipe if you have kids in the kitchen or if you're cooking with a significant other. So there we have our zoodles. So in our pot, I'm gonna add in a little bit of olive oil. While we're letting that heat up, I'm gonna take you on a little tour of what I have on this plate. So a lot of times when we think Alfredo, we think chicken, shrimp, noodles, sauce, but this version is a little bit more colorful and allows you to pack in some more nutrients. So I have some chopped kale, some chopped broccoli, some orange and yellow peppers, and then I also have some green onion for garnish. Many times people throw away the bottom, but I've actually cut up that lighter bottom because it's very flavorful. So we're gonna add that into our saute. I also have some fresh garlic and some chicken that's already been cooked. Our oil, I'm going to add fresh garlic. And then I'm going to add in the peppers, the bottom of our green onions, and the broccoli. We're going to toss in our kale. You don't want to overcook them. You want that really beautiful bright color and still a little crunch. And to that, I'm going to add a little bit of a spice blend with onion powder, garlic powder, some red pepper flakes, a little bit of Cajun seasoning, and Badia seasoning. That's one of my favorites. We've got our vegetables and chicken mixed together. Now, I hate to do dishes, so we're gonna make everything in one pot. So I'm gonna set our vegetables and chicken aside, and then we're gonna make our Alfredo sauce in the same pot. Okay, so to our pot, I'm going to add our butter and try to go lighter on the butter in this one because we wanna be flavorful but still health conscious. And to that butter, I'm gonna add some more fresh garlic. Drop the heat down to low to medium because you definitely don't want to brown your butter. And then you also don't want to burn your cream that we're about to add into the Alfredo sauce. And then I have half a brick of cream cheese. I'm gonna add that in. I'm going to add in a little heavy whipping cream. Again, you can go with a lighter milk product if you want to use whole milk or 2% milk to still get that creaminess but have less milk fat. Completely fine. We're going to add in some grated Parmesan cheese. Once your cream cheese starts to melt, you want to use a whisk to kind of bring all of your ingredients together. You'll notice in the sauce and in the recipe as a whole, I am not using additional white salt. In the spice blend that I mentioned, that Cajun seasoning and the Badia complete seasoning already have some salt in it, so I do not add additional salt. That's something that I really want to talk about because when people are trying to make food flavorful, they tend to add more salt. And really, you can play around with your flavors of the vegetables that you're adding, your fresh garlic and your spices, instead of adding additional salt. So that's why our vegetables were so colorful and plentiful, was really to help contribute to that flavor profile. This sauce looks beautiful. So we're gonna toss in our noodles, our zoodles, our sauteed vegetables and chicken. Then we're gonna garnish it and we'll be finished. Now I'm just gonna take some of our noodle and zoodle pasta mixture, add that to our bowl here and garnish that with some green onions and some sliced tricolor grape tomatoes. Again, another great way to get some vitamins and nutrients and add in some color. So I'm gonna give this a try. Turned out really delicious and flavorful, and all of the vegetables came together for a really nice flavor profile, and the red pepper flakes really helped set it off with a nice little subtle heat, and there's a great contrast with these grape tomatoes. I really hope that you try this recipe. As you see, there are a lot of different ways that this recipe could go. I'd love to hear if you tried out. Post pictures and you can tag me in them. And you can follow along with me on social media at Kanimi Kitchen, and that's K-I-N-I for Nicole and M-I for Miller. So Kanimi Kitchen, on Instagram, Facebook, and you can visit KanemiKitchen.com for more recipe ideas and some other really cool food content. Thanks again for having me, and I look forward to connecting soon. Bye.
Well, we thank Kirby for doing that. It really, I don't know about you, Carla, in this quarantine, I have been struggling just with some what to cook questions, every night. It's like, what is in there? What can we cook? How can I be creative? So something that is healthy, that is smart, fewer calories, that's so needed.
Absolutely. And again, we want to thank Kirby Miller for that. So we're going to take a break. And speaking of taking care of yourself, with some more tips from to help you in the pandemic.
Okay.
To help protect others from COVID-19, DHEC encourages everyone to wear a mask or cloth face covering when in public. Make sure your mask covers your nose and mouth, and you can breathe through it. Remember to clean your hands before and after putting on your mask, and try not to touch the mask or your face while wearing it. Don't use a mask on children under the age of 2, and don't use surgical masks needed by healthcare workers. Help stop the spread. Visit scdhec.gov/COVID-19.
This is Dawn Staley, head coach of the University of South Carolina women's basketball team. In the fight against COVID-19, we all have an important role to play. Let's stop COVID-19 and spread caring. And remember to stay careful and stay connected. Visit DHEC's website for more ways to stay South Carolina strong.
Well, everybody loves Coach Dawn too, don't they?
Yes,
She
they
is
do.
always on the move.
They stay moving over there. Those young ladies on that team, they stay in great shape, workouts, ready to play, ready to hit the court. So great advice from the coach. That's definitely something you should listen to.
Well, I want to introduce you, Carolyn, and everybody else to a couple that stays on the move. Leslie and Jeff Jones. They are the creators of Afro Flow Yoga, and they're going to show us how to relax and enjoy the beautiful music as they present this presentation in yoga.
Hello, Health Wrap. Welcome to Afro Flow Yoga. My name is Leslie Salmon Jones. I'm joined by my wonderful husband, Jeff Jones. We're the founders of Afro Flow Yoga, which is a combination of yoga, dance, live music, and meditation. Today, we are offering you a very short relaxation segment, so we invite you to get comfortable, maybe sit on a chair, stand up, or sit on the floor. And in this moment, what we begin with is the breath. Breath is life. When we inhale, we're bringing energy into our cells and organs. And when we exhale, we can relax and let go of any stress and any anxiety and fear. So I invite you to stand, sit in a comfortable position. Feel your feet on the earth. This is where we connect to our ancestors. We connect to the earth, the power of the earth. Place one hand on your heart and one hand on your belly. And begin to feel the sensations in your hands, through your feet, connecting all the way up through the crown of your head to your highest truth. And maybe close your eyes or soften your gaze. And then as you begin to notice your breath, take a deep breath in through your nose and exhale out through your mouth. Again, inhale through your nose, filling your belly up. And exhale out of your mouth as if you're exhaling out of a straw. This time, inhale love. And exhale fear. Inhale peace. And exhale anxiety. Inhale light. And exhale stress. Beautiful. Stay with the breath. And this time, reach your arms up toward the sky. Inhale. And drop them to the earth. Take another deep breath in. And deep breath this time through your heart. And again, inhale. Reach up toward the sky. And exhale to your heart. And then connecting to the wind and the water, the fire within you. Begin to move in any way that feels natural to you, releasing any stress, maybe in your back, in your neck, in your shoulders. Beautiful. And then take a deep breath in, bring your hands to your heart, inhale and open your heart wide. And exhale, release and stretch out your back, your spine. And again, inhale, open your heart wide. And exhale, pressing away anything that's not serving you. And one more time, this time, imagining you're opening to light and love. And exhale. Beautiful. And then take a deep breath in and begin to let go of any stress, anything that's not serving you. Just give your arms a little shake it out. Shake, shake, shake. Breathe. Beautiful. And then take a deep breath in and exhale, slowly lower it down. Place one hand back on your heart and one hand back on your belly. Maybe close your eyes, soften your gaze, come back to your breath. Know when you take a few moments of relaxation, you can reset, recharge. Take a deep breath in and a deep breath out. Thank you for joining us. Take good care. Blessings to all.
And Carolyn, an interesting fact about Leslie, she is an Alvin Ailey trained dancer. And you can go online to take their classes while we're in the pandemic. And all the money, you can make a donation. They're not charging you. So I'm going to sign up. I'm going to see if we can sign up together. But they are taking donations, and all the donations go to people who are in need.
Well, there are so many people, Carla, that are figuring out great ways to take their time during this pandemic and help other people. And those kinds of stories just always, they warm our hearts when we see them. The one this week that everyone has been talking about is a young lady in Minneapolis. She actually has been watching what is going on in her community and wanted to know how she could actually help. And this young lady, I think she's seven years old. Yeah,
she's 9 years old. Her name is Cameron Johnson.
Okay,
Yes.
I don't want to take those 2 years away. So
Yeah.
9 years old, and Cameron decided to come up with this idea of doing bracelets. And the bracelets she sold with her neighbors there at their stand, and it's called a bracelet booth is what they call it. And at the bracelet booth, you could purchase a bracelet, or if you wanted to be like our friends over at Good Morning America, you could just chip in a few extra dollars. She had already raised, I guess, like $20,000, Carla?
Yes, she has.
10, and that put it at 30. And then I think the last headline I saw had it at $40,000, which is, I mean, for a young lady at 9 years old to say, I'm going to do a little bit more than stay on the computer and watch movies. I'm going to figure out how I can raise some money to help people. If you want to get a bracelet or you want to help her in this magnificent cause of helping families in Minneapolis, her mom has got a Venmo, which is Shawnee-Johnson-1, and the bracelets are $3 each. And her note says, be sure to include your mailing address, and they'll go ahead and ship you out one of those bracelets, and you can be part of this amazing movement in Minnesota.
She calls them the friendship bracelets, and they're $3. So it would be fantastic to support. I love seeing an entrepreneur at this young, Carolyn.
Absolutely. I'm gonna have to get us a couple of these bracelets.
Okay.
Absolutely. I absolutely love what she's doing. It's just so inspiring. And talk about other folks that are doing things to, everybody should be thinking about how you can help others. I've often heard that when you are going through difficult times or when you are stressed out, one of the easiest ways to try to relieve some of that stress and tension is to help somebody else. It takes your mind off of your issue and allows you to focus on someone else who needs a helping hand. And we have so much to be grateful for. As challenging as the days have been, I know you and I have talked about this several times. We are blessed and we have a lot to be thankful for. But I was thinking of this one young man and how he has literally put his talents, or another set of his talents, together to tickle the ivories. And that's a doctor who's playing the piano, Carla?
Yes, it is Dr. Christopher Jackson. He is a PhD. He's also a physician assistant in neurology. And yesterday when I asked him, I said, can you send me some of your music? He says, I'm going into a surgery to assist in there and I'll do it as soon as I get in. So he's in the front line and doing surgery, assisting as a physician assistant. And he is also a scientist in a whole lot of other areas that he's done. But this gift of playing the piano, let's give an ear to Dr. Christopher Jackson.
He's going to sing us out this afternoon. We're going to say goodbye to you now, but we want you to enjoy the sights and the sounds of the good doctor.